Good evening. The following presentation is going to be discussing the role of social workers in improving the healthcare experience for clients with disabilities. So, to start things off, let's delve into some of the actual issues that clients with disabilities are currently experiencing when they are seeking treatment and in the healthcare settings. There was a report by the National Council on Disability in 2009 that reported that there's a significant absence in professional training on disability competency issues for healthcare practitioners, and that's one of the most significant barriers that prevent people with disabilities from receiving appropriate and effective healthcare. The report also found that there are significant architectural and programmatic accessibility barriers, and that healthcare providers continue to lack awareness about the steps that they're required to take to ensure that patients with disabilities have access to appropriate and culturally competent care. So, in this report, they also delved into a lot of qualitative studies and interviews with clients with disabilities about their experience in healthcare settings. So, in one focus group for clients that have vision impairment, they reported that many of the providers that they go to, they would kind of ignore the client themselves and kind of focus their questions on whoever the family member or peer who the client brought with them. So even though the client is visually impaired, the provider, instead of directing their conversation and their questions to the client, they would kind of brush them off and instead, direct their attention towards whoever the client brought in for support. Another thing that was reported was that healthcare practitioners, they frequently employed modes of communication that didn't take into account the specific individual needs of the clients with the disability. So rather than asking the client which mode of communication would be the most effective, healthcare providers tended to just assume what would be most helpful, and a lot of times they would get that wrong. Finally, one other thing that was reported, with clients with intellectual and developmental disabilities, they indicated that healthcare providers really didn't make an effort to understand the extent that those with the disabilities could continue to still contribute to their communities as well as contribute to their own management of their own healthcare. So, to further give context to why these are such important issues and a lens of which to view these issues as well as potential solutions, let's talk a little bit about the social model of disability. So, this is a relatively newer way of thinking, and it separates the terms or the concepts of impairment and disability. So under the social model of disability, they see impairment as a state of the body that's maybe lacking or defective. So whether it's an organ, a limb, or a mechanism, there is some deficit there. However, with impairment, it doesn't necessarily need to be met with a negative evaluation or have a negative connotation to the client who has it. One example is that a client who's blind from birth, they might have visual impairment, but they might see their blindness as a state of neutrality, so a state of neutral, and that's what's normal for them, rather than something that is a major problem. In contrast, the term disability under the social model disability, it refers to kind of the disadvantage or restriction of activities that are caused by social structures, actually, and they don't really take into account the actual limitations and impairments of someone with disability, but it just makes a lot of assumptions about what they can and can't do. In many ways, the societal oppressive factors can disable our clients more than the actual impairment themselves. And so, under this model of disability, it's just a way to kind of lend support and give context to the kind of the unjust treatment and the tendency of healthcare practitioners actually to medicalize all of the impairments that a client has and further disable them. So where do social workers come in? For us, one thing that is very important to the practice of social work is our value-based practice. So according to the Code of Ethics from the National Association of Social Workers, the primary mission of social workers is to enhance human well-being and to help meet the basic human needs of all people, with particular attention to the needs and empowerment of people who are vulnerable, oppressed, and living in poverty. The mission of the social profession is rooted in a set of core values, and these core values are kind of the foundation of our purpose and perspective. With this code of ethics that I'm reading from, they represent just broad ethical principles that establish a set of ethical standards that guide our practice. And the reason I'm bringing this up is before we start a conversation about how social workers can influence other professionals, we need to make sure that we're faithful to our values ourselves. So I've picked some ethical standards from the Code of Ethics that kind of showcase how the values that guide our practice are extremely important for any healthcare professional when working with clients with disabilities. So in section 1.02, social workers are to respect and promote the right of clients to self-determination and assist them with their efforts to identify and clarify their goals. So as previously discussed, a lot of times other healthcare practitioners, they tend to assume what the client is there for, or if a client will come in with a disability, the healthcare professional will assume that all the problems stem from their disability instead of looking at the problem more holistically. In section 1.04a, social workers are to provide services and represent themselves as competent only within the boundaries of their education, training, license, and certification. So what that means is that it kind of guides social work practice in the sense that if a social worker is expected to do something that's outside of the scope of their education, it becomes our responsibility to either attain that education or attain that information, or to properly refer our client out to a professional who can meet the needs of the client. And lastly, in the standard in section 1.05b, that social workers should have a knowledge base of the client's cultures and be able to demonstrate competence in the provision of services that are sensitive to clients' cultures. Again, so as part of how we practice and the ethical values that guide our practice, cultural competency, which would include the culture surrounding those with disabilities and their specific disabilities, is something that's integral and something that we need to practice with the education of, rather than something that we could skip or bypass. So let's go into some solutions. On the micro level, so currently there's a growth in the practice of integrated healthcare, which entails many different healthcare professionals, so primary care physicians, nurses, other specialists, and behavioral health specialists, which could include social workers, are starting to work together on a team in a healthcare setting to treat the specific needs of any client that comes in. So rather than separated silos of care where there's a lot of miscommunication or lack of information, any client who comes in with an issue will be assessed for and will meet with any healthcare professionals that also happen to be on a team together who can discuss the client and figure out from their own areas of expertise how to best serve the client. So with this growth of integrated care, social workers are starting to have a lot more influence, impact, and kind of just increased interactions with other healthcare professionals who might be treating clients with disabilities. So in a way, with all the values that social workers bring to the practice and all the education that they have on competently working with those with disabilities, social workers can now, more than ever, share that knowledge with other healthcare professionals and make sure that kind of hold other healthcare professionals to the same standard that the social worker would hold themselves to when working with any clients with a disability. That's kind of one of the benefits of this growth of integrated care. But then again, that inevitably leads just a discussion about why that solution is required in the first place. So that'll take us to kind of like the macro level, upstream determinants of why these deficits in the practice of other healthcare professionals exist in the first place. So at the moment, again, it's a good solution for social workers to communicate and make up for that gap in education surrounding disability competence with other healthcare professionals. But when we look at this issue through the lens of the social model of disability, it kind of indicates that there's a much larger social issue. There's a huge lack of priority and urgency for other healthcare professions to provide this education that social workers are getting, even though they very often engage in practice, and in the practice of treating those with disabilities. So they're treating a population that they're not getting proper education on. And at the moment, there's still no priority or sense of urgency to address that. So where a social worker can come in is advocacy. So advocate on multiple levels within any agency or healthcare clinic. The social worker could, be the voice to advocate for proper education of all the healthcare professionals and staff members on the team inside that clinic. On the level of of federal policies or state policies, social workers can fight for, the requirement of disability competency education for all healthcare professionals. This can be done on multiple levels. So, for healthcare professionals still in school, this could be added to the education curriculum. So, any new healthcare professionals coming out of schooling will have this education. For current practicing healthcare professionals, maybe incentives can be created. In addition to, again, just requiring them to attain education on, competency with the disability population, just to, again, further address this larger issue that's caused these deficits in the first place. To summarize everything, so currently there are major issues concerning the healthcare experience of those with disabilities when they seek out healthcare treatment from many various healthcare professionals. In addition, like in accordance with the social model of disability, what happens here is because there's such a lack of adequate education on disability competency, a lot of healthcare professionals could serve to further disable clients or give them further their feelings of being disabled by the way that healthcare professionals are currently, engaging in their practice. So on a micro level, because of the ethical principles that guide social work practice, social workers can play a huge role in addressing these issues by providing education to other healthcare professionals in the integrated care settings. But on a macro level, to also, again, to view this from the social model of disability, social workers can also be a part of the solution by advocating and using the advocacy skills to kind of change the societal structures that cause this lack of education in the first place. So societal structures like the stereotyping or negative stereotyping or the indifference or the apathy towards, properly treating individuals who do have disabilities.